It's live, sir. It's live.
Okay. How to ask the other people to join in YouTube? Anyway, link is there. Everybody has been shared the link. That is no problem.
Dr. Rajendra Prasad?
Yes, sir.
Dr. Vijeta here. You want me to leave so that others can join?
No problem.
Okay. Okay.
I will just find out what can be done.
Sir, madam left, but the other person joined.
That is what.
No, it will be difficult. No, that won't be good. John, I think it is better to go live on YouTube because others will join there.
It is on live, sir. It is live.
Okay.
Our secretary has not joined, isn't it?
No, not yet, sir. John, create a separate room for them so that they can join separately.
No, sir. We have a maximum limit of 100 participants.
Okay, no problem. We can go ahead. I can see from the YouTube channel.
Yes, sir.
Huh?
Yeah, I'll just give me 1 second, sir. Suriraj sir is calling. There's one person with same name. I'll put in waiting room. I'll see.
Okay.
So John, whoever is trying to join, they will get a YouTube link.
Dr. Pawan Kumar.
Yes, sir.
You can hear me, isn't it?
Yes, sir.
Yes, sir. Okay, right. I will read the IMA prayer. Meanwhile, let John try some method of entering them.
Okay, sir.
Okay, sir. I will go ahead. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. May everybody be happy, may everybody be healthy, may everybody be free from pain, may everybody be free from sorrow, may we be the healing cure beyond every greed and lure. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಲಿ.
Sir, Veerabhadra sir has joined, sir.
Okay, sir.
Thank you very much, to you, Professor Dr. Pawan Kumar.
Thank you very much, sir. A warm good evening to everybody. ನಮ್ಮ ನಾಡು ನುಡಿ ಜಲ ಹಾಗೂ ನಮ್ಮ ವೈದ್ಯಕೀಯ ವೃತ್ತಿಗೆ ನಮಿಸುತ್ತಾ ಈ ಸುಂದರ ಸಂಜೆ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮವನ್ನು ನಾವು ಶುರು ಮಾಡ್ತಾ ಇದ್ದೇವೆ. I welcome everybody to this wonderful evening. In the beginning, I want to welcome our Karnataka State Branch President, Dr. Veerabhadra sir, to the meeting. Welcome, sir. A warm good evening to you, sir. And I'd also like to welcome Dr. Suri Raju, the Secretary of Karnataka State Branch, to this meeting. We welcome you, sir. A warm welcome to you. And I would like to welcome all the seniors of Karnataka State Branch, office bearers, and all the presidents like who have joined the meeting. And I would also like to welcome all the enthusiasts like who have joined this meeting, because this is the very important topic that we are going to discuss today. Because in the previous days, like we used to see that all doctors used to be worried like whether there is any negligence or whether there are any mistakes that will happen during practice. But nowadays the patients they are waiting for doctors to make some mistakes or some negligence so that they can have some claims, or even nowadays it has gone further ahead that even they are trying all the doctors for false claims. So I think we should be very much careful during our practice, like what all we should do, like how like we can face the situation. All these things will be discussed today. Over to Dr. Rajendra Prasad, sir, where he'll be introducing us today. Over to you, sir.
Sir, I request our President, Dr. Veerabhadraya, sir, to inaugurate the CME, sir.
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಇದು ಒಳ್ಳೆ ಟಾಪಿಕ್ ಅನ್ನ ಸೆಲೆಕ್ಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದೀರಿ. ಈಗ ಲಿಮಿಟ್ ಅನ್ನ ಮೀರಿ ಜನ ಸೇರ್ಕೊಂಡಿದ್ದಾರೆ ಅಂದ್ರೆ ಇದು ಇಂಪಾರ್ಟೆನ್ಸ್ ಗೊತ್ತಾಗ್ತಾ ಇದೆ. ಸೊ ಅದಕ್ಕೆ ಈ ಒಂದು CME ಯಶಸ್ವಿಯಾಗಿ ಜರುಗಲಿ, ಎಲ್ರಿಗೂ ಅದು ಒಳ್ಳೆ ಮೆಸೇಜ್ ನ ಟೇಕ್ ಹೋಮ್ ಮೆಸೇಜ್ ಕೊಡ್ಲಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಹಾರೈಸ್ತಾ ವಿಶ್ವ CME ಆಲ್ ದ ಬೆಸ್ಟ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you very much, sir.
Sir, Dr. Suri Raju sir also is in, sir.
He has joined.
Okay. Sir, we welcome from Public Health Committee, we welcome Dr. Suri Raju, Karnataka State Branch Secretary, to this meeting, sir.
Thank you so much.
I request you to speak few words.
Yeah. First of all, I want to congratulate Public Health Forum, houseful. I am trying to log in into the Zoom meeting since last 5 minutes. It shows the enthusiasm and the real requirement of this kind of topics, because everyone are very eagerly waiting. And as we all know, not knowing the law that protect us is our fault. And ignorance in medical legal matters can be dangerous. I think to enlighten us, we are fortunate to have Dr. Vinay Kumar with us today. And his qualification itself speak for his vast knowledge. I warmly welcome him. At the same time, I want to congratulate Professor Dr. Pawan Kumar M for choosing such a wonderful topic. And it is the real need of entire doctor community. I welcome our President, Dr. Veerabhadraya PS, sir. And I welcome Dr. Rajendra Prasad. Thank you. Thank you all.
Thank you very much, sir. Over to you, sir. Rajendra Prasad, sir. Please introduce the guest speaker, sir.
Dr. Vinay Kumar S. has done his law degree from National Law School of Bangalore, and he is a professor of pediatrics at SS Institute of Medical Sciences and Research, medical legal advisor, Davangere, Karnataka, founder of Medical Legal Aid, an e-learning platform for doctors, past president, Karnataka Medical Legal Chapter, IAP Karnataka, Secretary, Karnataka Medical Legal Group, IAP Karnataka, Joint Secretary, Karnataka Medical Legal Group, IAP Karnataka. And this website, everybody can note down so that they can visit whenever requirement is there. Over to Dr. Vinay Kumar.
Sir, is it audible, sir?
Yes,
Yes,
sir.
sir.
Very,
Audible and slideshow, sir.
Yes, sir. Yes, sir. I'll start. 1 second, sir. Okay. At the outset, I would like to thank Dr.
Sir, it's
Veerbhadraya,
not
sir.
at full screen.
Is it full screen, no, sir?
No, no, sir.
It may take time. It is full screen from my end.
Okay.
Now, sir?
Prasad, sir, it's full screen now.
no problem, sir. You can continue.
Yeah, yeah. Okay.
At the outset, I would like to thank Dr. Veerbhadraya, sir, President IMA KSB, Dr.
sir.
Suriraju, sir, Dr. Rajendra Prasad, sir, and Dr. Pawan Kumar, sir, for giving me this opportunity. I will start with the topic. Now, the medical negligence cases on doctors are on rise. So, it is mandatory, not an option, for the doctors to know about what constitutes medical negligence and what are the legal remedies available for the protection of the doctors. So, let us understand by first learning what is the definition of medical negligence. Medical negligence may be defined as omission to do something which a reasonably competent man, a medical practitioner, would do, or doing something which a reasonably competent medical practitioner wouldn't do, which has resulted in the damage. Two words what the doctors must understand: it is reasonably competent doctor. Every time it is reasonably competent doctor. That means the standard expected by the court is not too high, not too low. For example, I am a pediatrician. The patient may come to me with a cough. I am a auscultant. I may treat it like a reactive airway disease or asthma. But later it may go to some senior who may pick up it as a foreign body. So I won't be held negligent for missing the foreign body diagnosis because it is not very easy to pick up a foreign body. So I have done a reasonably competent doctor performance. So that is enough for the law. So the standard is not very high, not very low. Then what constitutes medical negligence is always contextual. That means, for example, a patient with shock is admitted in a taluk hospital or a nursing home may just get a IV fluids and inotrope. If the same patient with the shock comes to medical college where I are working, we may put a intra-arterial BP monitoring. But if the same patient may go to AIMS Institute or a tertiary care of an institute of national importance, they may do ECMO also. So the person who is sitting in a tertiary care cannot tell that the person who is acted in a periphery is negligent, because the quality of the treatment given will always depend on in what context the patient is admitted. So law also understands this very much. So negligence is not an absolute term but a relative term, and rather than a comparative term. So it is comparing with what? It is comparing with the local standard. The standard is not very high, not very low. No absolute standard can be fixed. No mathematically exact formula can be laid down to tell what is negligent and what is not negligent. So what are sentences I am telling are picked up from the judgments. What constitutes negligence varies under different conditions, and in determining whether negligence at all, the attending and the surrounding facts and circumstances has to be taken into the account. As I said, if negligence, if the case of negligence has been filed in a taluka place, the quality which is given in the taluka will be a standard for that case. It won't be compared with a medical college standard. If a patient is admitted in a medical college, the standard of a medical college, the treatment given in other medical colleges will become a standard for that patient. So why doctors should know what is negligence is, if under civil negligence, the compensation can be awarded. Under criminal negligence, the punishment can be given. If the patient goes to consumer court, the deficiency of services under the Consumer Protection Act will be there. And if the patient gives a complaint in the Karnataka Medical Council or any medical council for that matter, the professional and disciplinary action can be taken. So doctor has to know what is negligence, because once he knows what is negligence, of course he is not going to do any negligent act. So without knowing, the problem comes. So what doctors must understand is what are the legal principles governing the negligence, what are the landmark judgments that shape medical legal liability, and what are the practical safeguards that can protect the doctors from litigations. So what are the components of medical negligence? There should be duty of care, that means there should be a doctor-patient relationship, and there should be dereliction of duty, and there should be damage resulting to the patient because of the dereliction of duty. That means there should be a direct causation of damage by the breach of duty. Let me give you an example. If a unit chief doesn't see a patient, but other qualified staff has seen the patient, even if the outcome is bad, then it cannot be held negligent because there was no direct causation. So unit chief not seeing the patient has not led to the damage to the patient because someone else has seen. So whenever there should be a duty and there should be a dereliction of duty, and that dereliction of duty should have caused damage to the patient. So without damage to the patient, either in the form of financial or emotional, the patient cannot file a case against the doctor. So damage component has to be there to complete a claim of medical negligence. So who is going to decide and how the courts are going to decide whether medical negligence has occurred or not? So court has come out with few tests. So what are the important judgments for which a doctor has to know is, one is Boehm's test. This is very important because in India still Boehm's test is widely followed, and I will explain in detail what are the importance of Boehm's test when it comes to filing an FIR. Next comes the Bolito test. Next is the famous Jacob Matthew judgment and Martin D'Souza judgment and continuous development, because as you know, all Supreme Court judgments become law of the land. So these four are the basic judgment based on which I am going to teach you what are the components of how medical negligence is decided by the court. So let us learn what is this Boehm's case. The patient name was Boehm, was suffering from depression. So doctor has planned electroconvulsive therapy. So after electroconvulsive therapy, severe pelvic fractures resulted because doctor didn't use relaxants before giving a electroconvulsive therapy. So doctor also didn't restrain the patient. So what are the allegations made against the doctor? There was a failure to use the relaxant drugs, failure to restrain the movement, failure to warn about the risk of fractures. Hence negligence in treatment was claimed, and the allegation was made that hospital should take the responsibility. Basically, this was the patient who was posted for electroconvulsive therapy, and doctors opted not to relax the muscles and not to restrain the patient. So this allegations was made by the patient party. So what are the questions to be answered by the court is now whether really a hospital is negligent, because what is the standard of care for a patient who is undergoing electroconvulsive therapy? Whether relaxants has to be used for all cases or whether it was an option to use the relaxant. So the judges were also not sure who has to judge the professional skill, because judges in India also, they are also aware that they are not medically qualified to decide which is negligent and which is not negligent. So they have to decide what is the role of expert opinion also. So what judges have done is they asked for the expert opinion to decide whether there was a negligence or there was no negligence. What happened is few experts favored use of relaxant. Few experts told that patient has to be warned about the risk of fractures. Few experts told manual restraint is needed. And they told hospital has failed to safeguard these things. Hence, few experts suggested that negligence has happened. But what happened? The doctor side experts, they told relaxants carry mortality risk, and if you warn the patient about mortality and fracture, he may not take a treatment at all because patient is already depressed and he will be deprived of a quality treatment. And the practice of giving relaxant and tying the patient or restraining the patient varied across different hospitals. So they claimed that accepted technique was used. So the option was to restrain or not to restrain a patient was left to the doctor. So doctor has selected option of not restraining, which is also a standard modality of treatment. So they claimed no negligence. That means here for a same disease you had a different modalities of treatment. And when the experts give their opinion, they also varied in their judgments. So what court has observed is doctor is not negligent if if he is following a accepted practice, even if the another agree. Negligence is equal to failure of a reasonable care. It is always failure of a reasonable care, not very high, not very low. Care, what is the care? Is care of an ordinary skilled professional. So not the highest skill which is required. So ordinary competency is sufficient. So after this Bolam test, this became cornerstone in deciding whether the medical negligence has happened or not. This protects the doctor who is acting responsibly. This defined professional negligence, and this protects the diversity of medical practice. This is very, very important, because patient cannot just go on putting the case against the doctor because doctor has not followed a particular modalities of treatment. Because as medical practitioners, we know every disease has 3-4 options. So if you select one option over the other, doctor will not be held negligent. This is what is explained in the Bolam test. This protects the diversity of in the medical practice. It is still cited today and adopted widely in India. So before filing an FIR, this test has to be done in India. This is the judgment given in the Jacob Matthew case, that before filing an FIR, the police personnel should get Bolam's test done by a competent doctors. If they also feel there is negligence, then only the FIR has to be registered. So what has happened after that? You may ask me a question. For example, if a surgeon does an operation and leaves a scissor inside the abdomen and comes out, when the case goes to court, if the team of surgeons tell that leaving scissor in the abdomen is not negligence, will judges has to agree for this, just because group of doctors has suggested that is a normal practice? Of course it will not be accepted. So what is the Bolito case is, the patient had a croup, ultimately went into respiratory failure, cardiac arrest and severe brain damage, and allegations of failure to intubation was made from the patient party. Hence breach of duty and negligence claimed. Here again expert opinions, patient expert opinion from the patient side, they said intubation is necessary, and expert opinion from the doctor side, intubation was not indicated. And again opinions were divided. Both were opinions from a responsible people. So what has happened is, court has redefined Bolam test. That means court just is not going to accept the expert panel opinion unless it is logically sounding correct. So it is not enough to rely blindly on the expert opinion. The court will also weigh risk and benefits, and the decision given must be responsible, reasonable and respectable, and it must also withstand logical analysis. So what are the concepts derived from Bolito test is, court is not bound to hold that the doctor escapes liability of negligence or treatment or diagnosis just because he leads an evidence from the number of medical experts who are of genuinely opinion that doctor treatment and diagnosis was according to the sound medical practice. That means in the Bolam's test, it was the concept derived was, if a group of expert opinion tell that doctor is not negligent, then doctor used to be held not guilty. But judges have also refined in later Bolam's test that if the opinion given by the expert is not logically explainable, then even the expert opinion may not be considered in the court. But this is a rare situation. Most of the time in India, Bolam's test is still used. So what is the significance is, judicial scrutiny added to the Bolam, prevented outdated practices and ensured logical medical opinion. This strengthens the patient safety, and this also influenced Indian law to some extent. So what happens once what happens when the patient files a case in the court? The court will form an expert opinion, and the expert opinion will give a conclusion whether doctor is negligent or not. So this will be applied in civil and consumer court cases. But what if the doctor is arrested, but later Bolam test applied and it has proven that doctor is innocent? This can happen. No. Now a case of culpable homicide not amounting to murder was filed against the doctor. Now that becomes a non-bailable offense. Then doctor is arrested. When it goes to court, then they apply Boehm's test. But that time doctor was proven to be innocent. So what will happen to the reputation and harassment the doctor has undergone? So these questions, not doctor is asking. The judges have only asked this question. If you start applying the Boehm's test when the case is already in the court, that means already the doctor has undergone harassment, reputation is damaged, and the harassment has already occurred to the doctor. So that later if he proven innocent, but the damage has already occurred to the doctor, because doctor is a public figure. So what they have come out is, this was in detail discussed in Jacob Matthew versus State of Punjab case, where a patient Sharma was admitted to CMC Hospital Ludhiana, and patient developed breathing difficulty in the night, and patient was brought to the hospital, and there was delay in arrival of the doctors. Then doctors arrived, Dr. Jacob Matthew and Alain Joseph. Then they tried to connect the oxygen cylinders to the patient, and oxygen cylinder was empty and there was no backup cylinder. Attempt to arrange alternative cylinder was made. This has led to lot of 5 to 7 minutes. In the meanwhile, the patient expired. So this is a simple case. Patient was having breathing difficulty. There was inability. The oxygen cylinder was found to be empty. By the time doctors arranged one more cylinder, the patient expired. Then what happened? The patient relatives went and filed an FIR in the court, and alleging the doctor was negligent. So then the case was previous. This was the old case. 304A IPC causing death by negligence was filed. This is not just a case of civil negligence. This is a case of criminal negligence was filed in the court. The trial court, the junior court, framed the charges against both the doctor, and doctor went to High Court to get the FIR squashed. Again, High Court also dismissed the petition. Then Dr. Jacob Matthew went to the Supreme Court. In the Supreme Court, a 3-judge bench. If you remember, first of all, it is a Supreme Court, then it's a 3-judge bench. That means it is a constitutional bench. Whatever decision given by them will be applied to the whole India. So Dr. Lahoti heard this case, and he has clearly made a distinction between what is civil negligence and what is criminal negligence. Civil negligence is lack of due care. Criminal negligence is gross negligence of a high degree. Doctors provide a noble service and must be protected from harassment, and complaints are often frivolous, and criminal law can be misused, and safeguard of the doctors is essential, because any patient, any dead body going out of the hospital, the patient starts filing a case and doctor is getting arrested, and later when they go to court, they apply Boehm's test, doctor was found to be innocent. So these things you begin to happen repeatedly. So judges felt this is an abuse of power of law, and doctors needs to be safeguarded because they are doing a noble service. So what court has observed is, the criminal prosecution of a doctor requires a gross negligence, and a police must obtain expert opinion, preferably from a government doctor of the same specialty, and they should apply Boehm's test before the prosecution, and no routine arrest of the doctor should be made in medical negligence cases. That means the Boehm's test has to be applied before the prosecution, so that doctor will not be unnecessarily harassed by the police. So Supreme Court squashed the proceeding against the Jacob Matthew case. So I just want to add one line here. If a fake or a false case is filed against anyone, they can go to High Court to get it squashed. So Supreme Courts and High Courts have a power to squash any proceedings which are happening in the junior court. So what has happened? The Supreme Court has squashed the proceeding against the Jacob Matthew, thinking that he was not criminally negligent, because his intention was never to kill the patient. It was just the oxygen cylinder was empty. His intention was never to kill the patient. So entire proceedings against Dr. Jacob Matthew was squashed. So what is the procedure to be followed by the police is, once the complaint is made, these procedures has to be followed. They should ask for an expert opinion. So before filing an FIR or the charge sheet, they should obtain independent competent medical opinion, preferably by a fellow government doctors of the same specialty. The opinion must apply Boehm's test. What those doctors should do? Those doctors should apply Boehm's test. That means whether the doctor has acted in a reasonably competent manner, not very high or not very low. It is an ordinary competent person. then the decision to file an FIR comes. If the preliminary inquiry plus the expert opinion confirms that the offense has occurred, then only the FIR has to be filed. If no offense is disclosed, that means if the expert opinion gives a conclusion that no negligence has occurred, then they should close the complaint within 1 week. So no routine arrest. If only investigation is needed, arrest has to be done. Only if evidence collection requires arrest has to be done. Only if the doctors may abscond, which is impossible because doctors have nursing home, so many patients, of course they cannot abscond. Even judges of the Supreme Court has taken note of all these things that doctors used to get arrested unnecessarily. Hence they have given clear cut directions in the judgment that no routine arrest has to be made, and arrest is in an exceptional situation only arrest has to be made. So after this, what happened? Every state government, because it is given by the 3-judge bench judgment, it applies to the all over India. So after that, all state governments have issued a circular to the respective police department. For example, I am just showing this Karnataka circular. This date is in 2021. See, they have quoted Jacob Matthew judgment, Ucha Nyayalaya, all those things. Okay, so what is the procedure to be followed before arresting the doctor? See, they have mentioned clearly that Boland's test has to be applied. See here, ಆಪಾದಿತ ವೈದ್ಯರು ನಿರ್ಲಕ್ಷ್ಯ ತೋರಿದ್ದಾರೆ ಎಂಬ ಬಗ್ಗೆ ಮತ್ತೊಬ್ಬ ಸಮರ್ಥ ವೈದ್ಯಾಧಿಕಾರಿಯು ಮೇಲ್ನೋಟಕ್ಕೆ ರುಜುವಾಗುವ ಆಧಾರವಿದೆ ಎಂದು ಅಭಿಪ್ರಾಯ ನೀಡದ ಹೊರತು ದೂರನ್ನು ದಾಖಲಿಸಿಕೊಳ್ಳಲು ಅವಶ್ಯಕತೆ ಇರುವುದಿಲ್ಲ. Forget about arrest. Taking an FIR itself, they need to confirm that negligence has happened. So this is not only followed in India, not in Karnataka. See, this is one of the circular issued by Puducherry government. This is one of the circular issued by Cuttack. This is one of the circular issued in Tripura. This is issued in Madhya Pradesh. All over India, this has to be followed because this has come from a constitutional bench. So all the state governments has to follow this protocol before filing an FIR against a doctor in case of medical negligence. So now what if, because many of us doctors are not aware of our legal rights, even many police people also are not aware of these judgments. Forget about police people, many junior magistrates are also not aware of this judgment. So I have just purposefully taken out the name of the doctors because they are still practicing. This has happened in Karnataka only. Dr. XYZ was the state of Karnataka. A medical officer, Chikkodi, Belgavi district, complaint filed by Shabir, allegation of doctor performed surgery negligently caused severe damage to the life of the wife. Police action. Police, without following the Jacob Matthew judgment, without conducting a preliminary inquiry, FIR was registered under against section 304 IPC, that is causing death by negligence, and charge sheet was filed without a preliminary inquiry or a expert opinion. Unfortunately, the junior magistrate also took cognizant and issued proceedings against the doctor. Here the police people have also erred, and the junior judiciary people have also erred, because they would have asked for they should have picked up that the police people have not followed the judgment. So what has happened is Doctors Council argued that they cited Jacob Matthews judgment where Supreme Court laid down the principle to be followed to safeguard the doctors. They argued that police failed to obtain independent medical opinion, and arrest or prosecution of doctors should not be routine, and guidelines were ignored. The police tried to argue that the charge sheet itself showed criminal negligence, hence they arrested the doctor. The charge sheet is made by the police, it is not made by the expert doctor. So whatever conclusion given by the police will not be held valid because they are not experts in the medical field. So what to do now? The doctor has gone to High Court because High Court has the power to squash the proceeding. The High Court felt, Karnataka High Court, the police violated the Supreme Court judgments of Jacob Matthew and Lalita Kumari case, and the magistrate has failed to check the complaints before taking the cognizance. Both investigation and the cognizance were procedurally irregular and illegal, and the entire proceedings were squashed again. So if the police people don't follow these guidelines, immediately you should go to the Karnataka High Court or a concerned High Court and get the proceedings squashed immediately if they are not following these guidelines. I'll give one more example, Bhushan Katta versus State of Maharashtra, where a 4 newborn babies died in NICU. That what has happened in this case is the doctor in the NICU wrote calcium gluconate and sister give potassium chloride. Okay, so this potassium chloride push was given to the babies and 4 newborn babies died in the NICU. These babies actually they were not at fault because of the mistakes done by the nurse. 4 newborn babies died. FIR was filed against the doctor in 304 IPC, culpable homicide not amounting to murder against the doctor as well as the nurse. So again, now you would think as a general public, 4 newborn babies died because of error which has happened with the nurse. Now you think from a doctor's perspective, these type of errors are really possible or not? Of course they are possible. Now whether doctor or nurse is negligent, yes, they are negligent, but whether they had any intention to kill those babies, of course no, they never had an intention to kill those babies. So whether they are negligent from a civil or administrative purpose, yes, probably those doctors has to be suspended or nurses has to be suspended. Whether those doctors and nurses has to go to jail, no, because their intention was never to kill the babies. It was just a mistake. So what has happened is prosecution as a duty doctor, he was responsible for proper administration of the drug and his absence amount to the negligent, and committee recommended the action against him. The doctor told he never prescribed potassium chloride. Clinical notes showed calcium gluconate. CCTV clearly confirmed that the nurse administered the drug, and in most cases the absent could be a department dereliction of duty, not a criminal negligence. As I told, doctor argued that his intention was never to kill the babies. Now you apply the Jacob Matthew principle to this case and try to come to a conclusion whether doctor has to be jailed or not. Now his intention was never to kill those babies. So court said it was an administrative error. Nurse directly injected potassium chloride, which is against the medical protocol. CCTV evidence shows nurse administering the drug and doctor arrived later. Jacob Matthew principle is applied, and criminal negligence requires gross negligence with an intention of knowledge to kill, which was not present in this case. Hence, again, the doctor and nurse both were left, and the criminal proceedings were squashed against them, but the civil or negligence proceedings continued. So judgment given that court had the continuation of the criminal proceeding would be abuse of process of law. At most, you can do a departmental inquiry or administrative action against the doctor, but not a criminal liability. So charge sheet against the doctor were squashed again. You remember one case I gave example in Karnataka High Court in Chikkodi, Belagavi, where the procedure was not followed and FIR was squashed. Again here, a severe dereliction of duty has occurred, but the intention was never to kill those babies. Again, judges came to safeguard the doctors, and the criminal proceedings against the doctors were squashed. So these two judgments should give confidence to the doctors. Let us learn by one more case, Martin D'Souza, where the patient developed hearing loss after receiving the amikacin for severe infection while under care of Dr. Martin. The patient has filed a case in the National Consumer Court, and it has concluded that there was negligence has happened, and 7 lakh compensation was awarded. So here the patient was given amikacin, because of which patient has developed hearing loss, and patient has filed a case against the doctor, and National Consumer Forum awarded the compensation. Here doctor went to the Supreme Court because expert opinion was not taken. So he asked for the expert opinion. So expert opinion concluded that the culture report was showing sensitivity to the amikacin, and giving a sensitive drug was more important because that would have caused death of the patient. So giving amikacin was appropriate for that patient in spite of having a hearing loss as a complication. So the judgment given by the Supreme Court was Consumer Forum courts must refer medical negligence complaint to the expert panel before issuing notice to the doctors. They cannot just suo motu go on deciding the medical negligence cases because they are not expert. court must not substitute their own judgment for medical expertise. It is held that no negligence was proven and the treatment was medically justified, because this was the opinion given by the All India Institute of Medical Science doctor. The Supreme Court set aside the National Consumer Court judgment and clear the doctor of all charges. So now you know, in a criminal proceedings also expert opinion is needed, and in civil proceedings also expert opinion is needed. Even in the consumer court also expert opinion is needed. If a court decides without taking an expert opinion, it can be questioned in the higher courts. So I'll give, this is the last case which I will be discussing, Lieutenant Colonel Atma Singh versus Managing Director of Fortis Hospital, where the patient went to the hospital for a knee surgery and was referred to the endocrinologist because it was an old patient, and he did routine pre-op investigation where it was found to have a high potassium levels. Okay, high potassium levels. And to evaluate for high potassium level, they have done USG and CT which revealed left kidney tumor. Remember here, patient went for knee surgery. Patient didn't have any problem. It was an elective knee surgery. Incidentally found to have hyperkalemia, cause of which was evaluated, found to have tumor in the left kidney. Surgery was performed by a urologist. Patient was shifted to high dependency unit and was given Clexane. She developed bleeding and condition of the patient worsened. USG was shown, which is showing again secondary collection. And meanwhile, urologist went on leave, and a patient was treated by ICU in charge doctor. Patient condition deteriorated and was put on ventilator, dialysis, and conducted tracheostomy later. Again, ICU in charge went on leave. Patient ultimately developed septicemia and died. Okay, as a medical practitioner, we may feel, okay, this is possible. But you think from a patient perspective, patient went for a knee pain and dead body came out of the hospital. So of course they have filed the medical negligence case on the doctor, and in between urologist and ICU in charge also went on leave. So what are the allegations made is, urologist frightened that the tumor was cancerous and could spread to the body at any moment, and he insisted immediate surgery without explaining the operative complications, and patient was shocked and was not given any time to think, and alternative modalities like radiofrequency ablations were not discussed. No biopsy of the tumor was taken, and the surgery was performed by HOD urology, and he did not disclose any post-operative complications like pain. And Clexane has a side effect of bleeding which was given to the patient. Urologist admitted and he did not examine the patient again. It was found that hemoglobin was 6 and there was delay in transfusion, and UST should have been done earlier. Due to negligence of the doctor, more than 12 hours were lost in diagnosing the disease, that is secondary bleeding, and UST would have been done early, and the doctor Baba was on leave and there was no surgeon to take care of the patient, and X-ray revealed water in the lungs and pulmonology opinion was not taken. Tracheostomy should have been done earlier, and they paid 50 lakhs. So many allegations they have made. Probably some doctor would have only guided them. They have scripted it so well, like pulmonology opinion was not taken, he went on leave, tracheostomy should have been done earlier, hemoglobin blood would have been given, and they are not properly counseled and all those things. Now, how many of you think that the doctor in this case will be held negligent because the patient went for a knee pain, walking to the hospital, and ultimately dead body came out? So let's see what happened in the court. So you just think in your mind what could be your decision if you are a judge in this patient. So what has happened is, court observed all the necessary documentation required for the hospitalization, treatment and surgery was found to be intact, correct. From the medical literature, it is clear that hyperkalemia is a very dangerous condition which can cause sudden cardiac arrest. So doctor suggested immediate hospitalization as per the literature. So the allegation made by the patient that they were frightened by the doctor for ICU admission was not correct. They have shown the literature that hyperkalemia is a dangerous condition. Hence, the doctor was correct in admitting the patient to the ICU. So as such, no medical practice or negligence or unfair trade practice can be attributed to the doctor because of hyperkalemia. Next, biopsy of the tumors is not recommended because of the spread, and radiofrequency of such a large tumor is still in the experimental stage. Therefore, line of treatment adopted by the hospital was in accordance with the medical literature, because they also made an allegation that line of treatment was not correct. Here again, textbooks have proved that the line of treatment adopted by the doctor is very much correct. So high risk consent was also attached to the case sheet. And oozing from the abdomen was not because of Clexane, it is a routine side effect of the surgery. Drug Clexane was administered as per the standard protocol, because there was allegation that Clexane was given in excess of dose and all. And death on table was consent was also signed by the patient as well as relatives. D-dimer test was done, which was confirmation of sepsis. So patient died of sepsis, not of medical negligence. Now, allegation that doctor who conducted the surgery did not visit the patient is baseless, because in a multi-specialty hospital like Fortis, patient will be managed by a different department which came under the charge of competent and highly qualified doctor. Doctor admitted that he was on leave, but there was a vascular surgeon who came to see the patient daily. That means even doctor was on leave, but there was an alternative doctor who was seeing the patient. So patient was kept in ICU and doctors were looking after as a team. So patient cannot ask that this particular doctor has to see. It is not expected that the post-operative care will be taken by a particular doctor. And the second surgery was delayed because he was unfit for the anesthesia. So argument that tracheostomy should have been earlier cannot be said negligent, because patient is not the expert. The treatment cannot be given as per the whim and wish of the patient. These are the words written in the judgment. All the consent forms proves that before performing surgery, blood transfusion, anesthesia, consent of the patient was well taken on every occasion. Nothing was done without the permission of the patient. So all the medical textbooks clearly indicate that the problem which arises because of the old age, diabetes and the hypertension. Advanced surgery that has been undertaken by the doctor as per the guidelines of the medical textbook. Best effort of the doctor and the supportive measures and the world-class treatment was given, but in spite of that, the patient has died. The complaint has failed to prove any medical negligence. There is no medical negligence or deficiency in the service on the part of the opposite party. So question of compensation doesn't arise at all. So there is no merit in the present case. The same case is dismissed. That means what I'm trying to tell the doctor here is, if you properly follow the medical protocol, if you properly document things, if you take a cross consultation opinion, and even if you go on leave, if you make an alternative arrangement, and most important, if you take proper consent and document everything in the case sheet, even if the outcome is bad, the law is going to protect you. This is a classical example where a patient incidentally went to the knee surgery and ultimately died. So still, because doctors were medically correct and all the documents were proper, doctors were not held negligent. So let's test your knowledge. So now I have given you the concept of negligence. What is Boehm's test? That is the reasonable man test. And if the treatment followed, if the particular disease has 2-3 modalities of treatment, if you follow one modality, you will not be held negligent. And the care which is given is contextual. The care which is given in the peripheral nursing home, in a medical college, in a national importance institute are entirely different. They cannot compare those care with others. And before filing an FIR or taking a complaint, the police people has to take an expert opinion, and those experts are from the same city or the same district or the neighboring medical college. They cannot ask for an expert from a Bombay to judge what is happening in Davangere. So let us test your knowledge. I will ask few questions. Surgeon giving anesthesia, whether it is negligent or not negligent. Okay, most of the time this will become negligent unless the surgeon will prove that it was a life-threatening emergency to the patient. That's why there was no time to wait for anesthetist. He was induced the patient, or the surgeon is trained by government, or he has certified in giving anesthesia. Advertising as a specialist, even though he is not qualified, is negligent. Crosspathy. Recently, allopathic doctor was fined for prescribing Leo 52, which is an Ayurvedic medication. Unit head not seeing the patient, not negligence, provided that some other doctor has seen the patient. Failure to diagnose the disease when symptoms are atypical, not negligent, because you don't have to be highly skilled. If you are a reasonably good doctor, that is enough. If the symptoms are very atypical, even if you miss the diagnosis, that won't be held as negligent. Leaving a surgical instrument inside the patient body, of course, negligent. Even if the expert opinion gives their expert opinion come to a conclusion that leaving surgical instruments inside the body is normal, then also court is not going to accept, because the Bolito test, where the court is logically going to analyze the expert opinion. Choosing one accepted diagnostic test over the other, if both are accepted practices, not negligent, because doctor has liberty to select a modality of treatment. Performing surgery without patient consent, unless it is emergency, of course it is negligent. So failure to warn extremely rare risk, not negligent. You don't have to warn a rare risk of malignant hyperthermia when you give anesthesia to a patient, because it is very rare. Operating on the wrong patient due to mistaken identity, of course it is clearly negligent. Not checking oxygen cylinder before inducing a patient for anesthesia, of course it is negligent, because as an anesthetist, your duty is to check whether the oxygen cylinders are there or not. As a surgeon also, if you are operating surgeon, it is your duty to check whether oxygen cylinders are there or not. If you are not checking, you don't have an excuse. Performing procedure while intoxicated under the influence of alcohol, criminally negligent, because many I've seen many doctors boast that they do surgeries post party and all those things are criminal acts. Of course, the doctor will go to jail if they do such activities. So choosing one surgical technique over the another when both are accepted methods. For example, you have two approaches for a particular organ. If you choose one approach over the other, you are not negligent. The patient cannot go on putting cases against the doctor that he should have followed that mode of surgery. Failure to provide basic emergency care, negligent. Not using advanced equipment, if a standard equipment is still wisely accepted, not negligent. And just I want to say one line: all illegal activities remain illegal even if you do with the consent. That means many doctors have this opinion that if they tell it to the patient and take consent, they will be saved. So it is very much wrong. Even if you do illegal activities with the consent of the patient, it is still considered as an illegal activity only. So now what are the remedies available to the doctors against the false cases of medical negligence? As we have discussed already, one is getting the FIR squashed. So BNSS section 528 empowers high courts to squash the FIRs to prevent abuse of powers. If some police station or some investigation officers takes a complaint against you without getting a preliminary inquiry done, the procedure is not followed, you can directly go for asking squashing of the FIR. So grounds for squashing are: FIR doesn't disclose gross negligence, allegations amounts to only criminal negligence, no expert or medical opinion obtained. So you should give the reference of Jacob Matthews, State of Punjab. And of course in Karnataka people, you have to give the Karnataka government guidelines. So you can ask for an expert opinion. So courts have mandated that expert opinion must be taken before proceeding into the doctor, whether it is a criminal case or it is civil case or it is a Consumer Protection Act case. So without, if they give opinion without taking an expert opinion, you can always question it. Case reference, as we discussed already, Martin D'Souza case. Supreme Court has directed that consumer forums and the criminal courts must seek expert opinion before issuing notice to the doctors. Remedy: doctors can challenge the proceedings if the expert opinion is not obtained. Now you have a bail and protection. Doctors can seek anticipatory bail under 482 of Bharatiya Nagarika Suraksha Samhita. Arrest guidelines protocol protect the doctor from these guidelines, protect the doctor from routine arrest. Case reference again, Dr. Suresh Gupta versus government, where the judges have clearly told the arrest of the doctor is an exception because he is not going to run away because he has so many patients and nursing home there. So arrest must be exception. And you should buy, of course, professional indemnity insurance because it provides financial protection against the litigations, covers legal expenses and compensation. It is not a direct remedy but reduces the financial burden to the doctors. And we also have general exceptions again, which come as a safeguard for the doctors. General exceptions are like you might have heard in movies and all. No, when someone tries to kill someone, he hits him in his defense. So that will not be considered as a crime. So some doctor does a procedure with the consent of the patient, a grave risk procedure with the consent of the patient, and the patient dies, then he won't be held negligent because he has taken the proper consent. Example like that. So what are the general exceptions we have is Section 18, accident while doing lawful act. This is what happened in that case of Maharashtra, where potassium chloride was injected instead of calcium gluconate. It was an accident. The intention was not to kill. Likely to cause harm, but without a criminal intent. Section 19. Section 25, act not intended and not known to be likely to cause death or grievous hurt, done by the consent. Section 26, act not intended to cause death, done by the consent with the good faith. Section 27, act done in good faith for the benefit of the child or person of unsound mind. Section 30, act done in good faith for the benefit of the person without consent. Section 31, communication made in a good faith. So all these general exceptions come for the safeguard of the doctors. So what I have told you, what are the remedies available for the doctor is, first thing is you can go to get your FIR squashed. Then if the expert opinion is not taken, again you can object. After that you have a general exceptions, and of course you have an anticipatory bail and all. So why I am stressing these things are because doctors are getting stress as soon as you get a call from a police or just a notice from the police station. So in 2023 year, total of 2,72,198 murders were happened in the trial court, and conviction rate was 37%. See, murder is a crime. So that is so there is no that's an established crime. So there is no question whether the crime has happened or not. So crime has happened. In such situation also, the conviction rate is 37%. So doctors, if at all the case is filed, it is a medical negligence case where the happening of the crime itself is not sure, because the doctor never will have intention to kill anyone. So whatever has happened will come under the general exceptions or your expert opinion, preview of the expert opinion. So doctor should not get scared that any FIR filed against the doctor and doctor will not go to jail. So you have so many options before going to the jail. So when you have so many options, why doctors are committing such mistakes? The gynecologist in Jaipur, Dr. Archana Sharma, died by suicide when the police filed a case against her under 302 IPC. Next, a Kerala doctor dies by suicide after a child death in a surgery led by him. Why doctors are committing such things is because they are not aware of the rights. The murderers are roaming happily in the community after getting a bail. So don't think doctors will go to jail just because some patient has died, that too in spite of doing your best effort. So why we have all these things is we have fear of unknown. That means when we don't know, we get scared. So only way to come out of fear of unknown is when you fear something, learn as much as possible and gain knowledge. Your knowledge conquers the fear. So what is the trend now is medical negligence litigations have witnessed a 400% surge in the recent years. Punjab, West Bengal, Maharashtra, Tamil Nadu and Karnataka are the leading one. According to National Crime Record Bureau, between 2017 to 2022, over 1,000 criminal cases were filed against the doctor. So this rise in litigation can be attributed to heightened public awareness, Patient Rights and Consumer Protection Act awareness, seeking for legal remedies, because the compensation awarded is so high that it comes in paper and every patient start getting litigant, because so much of 50 lakhs, 1 crore compensation is awarded. Patients are also getting greedy and they are just filing case on every death. So why doctors are suffering is there is lack of legal knowledge, which is the major cause. Legal education is missing in undergraduate or PG training, where doctor enter the practice without basic legal safeguard. This gap leads to avoidable errors from the poor documentation and consent issues in the patient disputes. Just give an example, Kunal Saha case where 11 crore compensation was awarded. Krishna Kumar case, 1 crore 38 lakhs compensation is awarded. Indu Sharma case, Indraprastha Apollo Hospital, 1 crore compensation. Maharajana Agarscan Hospital, a pediatric case of ROP, 76 lakhs compensation with 18% interest was awarded. And medical negligence are cases are becoming next motor vehicle cases for advocates. That means if you anyone faced a motor vehicle accident, you will realize as soon as you go to police station, there will be someone to guide you to go to which advocate, because the motor vehicle case is high yielding case, because compensation will always be awarded. So medical negligence cases are becoming next motor vehicle cases. So this is from not from India. Of course, India also you have advertisement, but just I have not posted them. Many people advocates in the abroad, they already posting advertisement like this. Have been a victim of medical negligence. Free field to call, no obligation, no obligations. So they will take a cut from the compensation awarded. Victim of a medical malpractice, get your trusted your personal injury lawyer. So in abroad, this trend is already there. Most of the hospitals have already appointed a legal person from the hospital behalf, because the cases are on rise, and even their advocates are also advertising to the people that if you have any problem against any doctor, come and approach us and we are going to file a case. So ignorance of law is not an excuse. As initially said by the sir, ignorance of law is not an excuse. This is one of the most basic and cardinal principle of jurisprudence. That means no person can commit a wrong or offense, later claim that he was not aware of the same. Basically, after committing the act, the concerned person cannot say that he didn't know the law. I'll just give an example. In traffic signal, red means stop and green means go. I cannot tell to the police that I didn't know this, because ignorance of law is never an excuse. So once I start driving, the law presumes and mandates that I am aware of all the rules and regulations. Similarly, once I begin medical practice, the law mandates and presumes that we know the rules governing us. So we cannot go and tell in the court that, sir, MBBS, we have not learned all these things. We have not learned what is consent or how to write a certificate. We cannot say we have not learnt it. Law presumes that we know all these things. And for doctor, learning legal issues related to medical practice is not an option but a mandatory. So let's come to legal safety in medical practice. So you can visit my website. I have uploaded around 14 hours videos, legal classes videos, which is divided into 8 modules. Module number 1, we are going to learn introduction to the legal system and how doctors and law came together, how BNS and IPC differs, and how constitution relates to health system, and we will explore how Consumer Protection Act came into the picture. And module number 2, we are going to learn how to take valid consent and what are different types of consent, and you are also going to learn how to prepare a model consent form. In module number 3, you are going to learn how to handle medical legal cases in the hospital. What is intimation, what is FIR, what is the difference between intimation and FIR, and what are the rules when you examine a victim, and what are the rules when you examine an acute person, and how to document MLC cases, what is police intimation, what is postmortem, and all those things. And module number 4, the negligence, what just now I have discussed. This I have discussed again in detail with a 3-hour class with the examples of civil criminal negligence and what are the protections available for the doctors. And module number 5, we are going to learn what is vicarious liability. If the nurses staff commits a mistake, if a junior doctor commits a mistake, if a technician commits a mistake, what are the liabilities of the doctors and how to avoid those mistakes. And module number 6 is certificate writing, where you are going to learn how to draft a medical certificate and wound certificate, because this is one of the area where doctors are facing harassment in the court. And module number 7 and 8, we are going to discuss what are the top medical legal mistakes the doctors are making. So we have to commit to the legal safety. Don't wait till a case ruins your career. Please learn. This is my number, 9901320320. Doctors, don't get frightened. There is always legal way out. If a case is filed against you, don't take a steps like what I have displayed in those 2 slides, that Archana doctor and the doctor from Kerala. So there will be always law to protect. Remember, even the murderers are roaming free, and you are not doing any crime. Your intention is never to kill. You always try to save the patient. So never worry, law will always protect you. So you can follow me and type medico legal aid. I have an Instagram and YouTube channel where we are going to give regular medico legal tips, and you can scan this QR code to visit the website. This will be my last site. If any questions in the chat box or any questions in the YouTube chat box, I will be free to answer.
Thank you,
Vinay,
Dr.
actually,
Vinay Kumar.
Stop
Sir,
sharing,
thank
sir.
you very much.
Vinay, it was very nice. But after this BNS has come into existence,
Yes, sir.
the Jacob Matthew case is not valid, it seems.
Wrong, sir.
What is your
I
opinion?
think it is wrong, sir. Someone has told you wrong.
No,
It is wrong
actually,
information, sir.
according to BNS, the punishment will be 2 years imprisonment
Sir, difference between
maximum.
I will just tell the difference between BNS and IPS, sir. Sir, previous IPS, there was no word called medical negligence. So this the medical negligence cases against the doctors were filed as if an accident case. That means death by culpable homicide not amounting to murder. Now in the BNS, the medical negligence case has been clearly, the word medical negligence has been clearly defined, and they have increased the punishment. Previously it was only fine. Now they have made it fine plus punishment if the medical negligence is proved, that criminal negligence is proved. Other than that, the procedure has to be followed. The Jacob Matthew procedure has to be followed, sir. There is no excuse for that. I can share you the documents also.
Okay, thank you.
That is a wrong information.
Sir, Dr. Vinay, sir, it was a very good talk. But before we move on to the question and answer session, we have a small thing. Like, I really
Yes,
want
sir.
to thank you for excellent crisp talk on medical legal negligence. And
Thank you,
the
sir.
landmark case you have cited really noteworthy, sir. And the medical legal knowledge what you have imparted on us today is really immense. And I think you are really an encyclopedia of all medical legal cases. And it was really
Sir,
a good talk. But
No, thank
before
you.
we go to the question and answer, yes, sir. But before we go to the question and answer session, like I want to tell you all that IMA Karnataka State Branch as KPS Personal Protection Scheme, like where it will help all the doctors. And like we would like to go a little bit light so that our all the participants know like how to act like when there is a negligence or when they have a problem. So I would like to ask Dr. Rajendra Prasad to just brief about KPPS, and after that we'll have a question and answer session.
I will not take much time. Fortunately, we have got answer to some of the cases, not for the criminal negligence, but for where the CPA awards, consumer courts award fine, compensation. We have got a wonderful that is scheme by IMA Karnataka State Branch, professional protection scheme, that is the indemnity scheme. Dr. Madhusudan Karignur is the chairman. For some reason, he is not able to join this thing. That is why I am sharing the screen.
Sir, screen
and I
is
will
to
not
be
go through all
double-tapped,
the
sir.
slides. I'll just finish in just a few minutes. You see, the thing is, it is.
Rajendra Prasad, sir.
Yes, sir.
Is the sharing, just double click, sir, once.
It is not sharing.
No, sir.
You are not able to see the screen, sir?
No, sir.
No, sir.
You can just
double click.
Are you seeing now?
No, sir. I'll do one thing, sir. I'll share it.
Oh, okay, sir. I will stop sharing.
Yes, sir. It's visible?
Yes, sir.
Yeah,
I'll just take this screen and another one in the last. That is, professional protection scheme is done in such a way that the premium is very less. That is, to start with, it is 3,700 rupees, which cover indemnity insurance of 1 crore. As you see, no other indemnity insurance schemes give so much money, and it is very much professionally managed, and there is no fine print at all. Everything is taken care of. Advocates' fees and everything is taken care of, and up to 1 crore the indemnity insurance is given. All the things we can skip because any who is interested can go through the website of the IMA KPPS website and become a member. And total peace of mind it gives. And of course, nowadays everybody is getting notice for 1 crore. As the Dr. Vinay Kumar said, it does not mean that they will be really asking for 1 crore and the court gives 1 crore. But notice is somewhat scary for the doctors. Sir, you can just run through the slides. And it is managed by highly experienced advocates. And it is very much necessary that every doctor maintains the records so that he will be practicing safely. Any life member of the IMA Karnataka State Branch can become member of IMA Professional Protection Scheme. I request everybody to become member of IMA Professional State Branch and so also take the benefit of this insurance. Thank you, sir. Over to Dr. Professor
Yes, sir. Thank you very much for your insight on KPPS. The yearly installment will be somewhere around 500 rupees to 2000 rupees. So it is very less compared to any of the insurances you see. So I urge all the participants who are here and even others like who have not still become members of KPPS, please do become members of KPPS because there are set of lawyers, all well-trained people who will be there to guide you. So there is no need for you to pay any lawyer fees or anything. So there are a group of people who will help you. And IMA Karnataka State Branch is always in forefront to protect all the doctors. So I think with this, we'll proceed on to the question and answer session. Sir, to start the answer session, because like we have so many problems, it is very difficult for us to define a competency of a doctor or a nurse or a paramedic. And it is also very difficult to demarcate what are the responsibilities of hospital. And sometimes it will be very confusing to give an expert opinion. Keeping all these things in mind, there are so many loopholes also in the judiciary system. And even the patients, like their expectation will be too much. Sometimes most of them in the greed of getting a compensation, they'll be filing a case on doctors. So like we all doctors face lot of problems from all quarters. So to initiate the question, first I would like to ask sir, what is the responsibility of a hospital in case of a nurse or a paramedic or a doctor does negligence or some mistake? Like what is the responsibility of a hospital, sir, in that case?
Sir, let me explain you by giving an example. Sir, if I am driving, if my car meets an accident and the opposite car owner is Ambani, I want Ambani to compensate, not the opposite car driver. The same principle applies in the law. The vicarious liability comes into the picture, and the hospital owner and the doctor will be held negligent for all the mistakes done by the nurses or paramedic staff, because if you penalize the master, next time he will be careful in selecting the staff and training the staff properly. This in case of civil negligence. In criminal negligence, of course, the one person will be liable and he will be sent to the jail. But in civil negligence and consumer court cases, 99.99% it is the doctor who will be held responsible. Now, whether it's a doctor or the nursing home, of course, nursing home cannot escape liability by telling that the nursing home owner was not there in the OT or not there in the hospital at that time, or for that matter, a nursing home owner may not be doctor at all. So still he will be held liable, because if 100 rupees is generated from the patient, he is taking the maximum money from the patient. So when he is taking the money, he is also answerable in the law in the form of paying a compensation. Like how much a doctor will pay, how much a nursing home will pay, depend on the individual case. If a surgeon leaves an instrument inside the abdomen and comes out, of course maybe he has to pay 90%. If a ventilator gets switched off, or if oxygen cylinder is empty, probably hospital has to pay. Now it depends on individual case how it is divided, but nursing home, even if he is a non-medical person, cannot escape the liability. And
Yeah,
before
others,
answering,
like if there are any questions, please be crisp in asking the questions.
yes, and before I want to, because many seniors are there, sir, now, and many doctors belonging to many specialties are there. What I request them is prepare a medical legal module like 6 or 7 hours, so that you can train your specialty doctors, because even our every association is bombarded with academic knowledge. Now, I think we should think one step ahead. IMA or Pediatric Association, Gynecology, Surgery, Anesthesia Association, every association should prepare a module. Even I can help them in by all means, so that they can train the people in every district, or so that it should be like a one day workshop. Because most of the time doctors are getting caught because of these consent mistakes, and not writing a certificate mistake, not filing not sending a police intimation. All those things are easily preventable mistakes. So we should think in that direction as a torch bearers of the institution, so that we can train district wise. We can go on training the people. Once the module is prepared, it is easy to roll. We can train 10 people, and those 10 people can just go on teaching the district members.
So really, this is a wonderful thought, sir. I think our president, sir, is also there. I think he'll take this initiative, and so that we can train in each district wise, so that everyone
Yes, sir.
will be
Once
aware of
model is prepared,
medical legal
we
point.
will be there to help, sir. I'm one of the association members since many years. When I registered our post MBBS only. So we will be there to train the doctors.
Dr. Vinay,
Thank you.
Dr.
Thank you.
Suraj here.
We'll take
Yes,
up
sir.
the project.
Questions. Yes.
Very beautiful and very good presentation.
Thank
And
you, sir.
your video should be kept by each and every doctor as a reference video, because
Thank you.
so many important points are there. Doctor, I have two questions.
Yes, sir.
I think every doctor should keep this Jacob Matthew judgment in their OPD. I feel like
Yes, sir.
in the hospital or they should paste on the wall, because
Yes,
this
sir.
is the one which is going to protect them during some crisis like immediate arrest, or they get some arrest warrant. And the second thing is we should make the police aware about this case,
Yes, sir.
because many
Yes, correct.
people, many police stations are not aware. Unless we train them and teach them, it is not going to help. Third thing, doctor, in your case, although medical legal cases are in rise, what are the percentage of chances of doctors getting punishment in your opinion?
Like, sir, criminal punishment is almost negligible, sir. Like, doctor commits a rape on the patient, he will go to jail. This death by negligence, doctor has not gone to jail. I mean, a very very exceptional situation, especially after the Jacob Matthew judgment. But consumer court, they are losing around 20 to 25% of the cases, because not because doctor was negligent, because he didn't document.
Yes.
Most of the time doctors are doing their best and they are not documenting in the case sheet, and unfortunately only document speaks in the court. Like in that Atmara case, where the patient went for a knee surgery but ultimately expired, and doctor was not held negligent.
Yes.
So maybe consumer court around 20% they are losing, because not because they are mismanaged the patient, because they are not documented things properly.
So if you take proper consent and documentation, is good. Very rare chances of getting the punishment and compensation.
Yes, sir. Yes, sir. Absolutely.
Fine. Yes. Thank you so much.
Any other questions, please?
Dr. Vinay,
Yes,
this
sir.
is Dr. Shankar Narayan here.
Yes, sir.
With regard to the Kunal Saha case,
Yes, sir.
any idea what was the proportion of
Sir,
compensation?
she was working in US as a professor. So her
No,
income
not the
was in
calculation.
dollars.
Not the calculation.
Yes, sir.
The proportion of compensation to be paid by the doctor, hospital, and the breakup like that. There was a difference. I think there was a breakup given. The entire 11 crore was paid to from different sources. That's
Yes,
what I
yes.
had.
It was from a hospital owner, dermatologist, and a physician, multiple people put together. I'm not sure about the division, sir. So, but it was divided into multiple people because it was a
That's what.
multidisciplinary. It was a Steven Johnson case. It was
Yeah,
involved
I
multiple
know.
people. Yeah.
I know. But hospital paid like what percentage and doctors what percentage?
No, sir.
Any
No,
idea?
I'm not sure about the numbers.
Is there any way to get the details? Because it will help us know to understand how much liability was
Sir,
put on the
they won't
doctors.
explain, sir, in detail, like in the judgments.
Mhm.
I will send you the judgment, but division I am not sure, sir. I will try to find out.
So they have
Okay, thank
clearly
you.
they have divided. It also includes the interest.
Yeah, correct.
This
Interest
money also
also.
includes the interest. They have clearly divided how it is around 6 lakhs or 6 crores or something. And afterwards the interest was added. So it almost comes around 11 lakhs, 11 crores.
Yeah, okay, right, sir. But okay. There's one more question in the chat box regarding giving ring blocks by doctors.
Giving, sir?
Ring blocks, peripheral ring blocks, finger ring block or a wrist block or something like that, where there only anesthetists can give, and because orthopedic surgeons routinely give
Sir,
ring blocks for the
this is
finger cases like IND and
sir,
things like that.
if this case goes to court, they will form an expert team of anesthetists.
Okay.
And whatever they recommend, the courts will follow. Because I am a pediatrician, I don't know what is the curriculum of an orthopedician. If it is there in the curriculum, many people ask me, like, I can do that surgery, or this surgery. I will tell them if it is there in your curriculum, probably if you show your curriculum in the court, the judge will accept. Because recently one gastrosurgeon filed a case against the general surgeon for operating on appendicitis. Like what a general surgeon should do if he doesn't operate appendicitis. So whenever it is there in his curriculum, probably he will be safe. That is what my view about this. If the ring block curriculum is there in the orthopedician guideline of MS orthopedics, probably he will be able to defend. And of course, expert opinion matters. What they tell.
Right.
There is no yes or no answers for those things.
Sir, to add on to this, I think if in the curriculum, in the MBBS itself, most of the things will be there. So a person who has passed MBBS can do anything in that matter.
Sir, it depends, sir. One case where a pulmonologist has thrombolized the patient and patient expired. It was in the night and doctor was not held negligent. In another case, MD physician has seen a rheumatic heart disease where what all our case presentation were on rheumatic heart disease only in MBBS. But he was held negligent because he didn't refer to cardiology. It was a pregnancy and there was 9 months gap for him to take a second opinion. So individual case they will assess, and especially judges when it goes to national forum or high court or Supreme Court, they are very intelligent. They are going to dissect everything and find out each and individual case, and they are going to decide whether there was enough time to refer, whether whether he had a cross specialty within the city or within his hospital, and all those things put together they will decide whether to do or not to do, whether the doctor is negligent or not negligent.
Dr. Vinay, we have some questions.
What the role of KMC or NMC in if there is a negligence?
Sir, Karnataka Medical Council is a disciplinary body, sir. They cannot give award compensation. So they cannot tell you to pay money to the patient. They will decide whether you are acted professionally in a competent manner or not. If it is not there, they will erase your name for so many days depending on the permission. That is the power they have. Okay, sir. But whatever decision, and KMC is not doesn't have a manpower or money to investigate the matters by going into the place where the negligence has happened. So because someone has to fund, someone has to go find out and all those things. So KMC is we should take it as a professional thing, professional erasure matter. But whatever KMC decision gives, no, the opposite advocates will use it in the court, showing that KMC has held him negligent. So you also consider it as a negligent. But although judges may not listen, but we can use KMC. If it comes in our favor, we can show that in the regular court that KMC has given a clean sheet. If KMC has fined us, then the opposite advocate will use that in the KMC to show that KMC has held him negligent. But both are independent bodies.
Sir, sorry to interrupt, Dr. Anuradha. There are a lot of questions in the chat box, so I request you to answer because there are a lot of anxious doctors.
Dr. Vinay,
Yes,
one
sir.
question is regarding vicarious liability.
Yes, sir.
Regarding that, one question is there.
Yes, I will just open the chat box and see, sir. So that ring back we have answered. What if the allegations are against the government doctor whose expert opinion has to be taken? Sir, any expert opinion will be taken most of the time by the I mean, if you have a government medical college in that district, it will go to government medical college, HOD and the team. Or it will go to, if medical college is not there, it will go to DHO and DHO will form a team. And whether it is a government doctor, private doctor, government doctor is only going to investigate and come to a conclusion. And we should make sure that only our specialty, our specialty doctor is involved in the expert opinion team. Otherwise, someone else may give a different opinion. Next question. My staff has caused urethral rupture, catheterizing the patient files a case. Am I negligent? Of course, we are only negligent because law presumes we should train the staff properly and we should appoint a competent doctor. So vicarious liability comes into the picture. Someone has written, I missed first of YouTube recordings, they can see. How valid is the DNR or DNE consent in the court of Indian setting? Can the ventilator be disconnected if the patient terminally ill, fertile? Is it legally valid in India? See, there are, one thing is will, like how they write a property will. There is also new concept which has come in the code, which is called as will of the person to do what to do when he becomes very critically ill. If he has written, don't put me on ventilators and all those things, you can follow it. But that is very rare scenario in Indian scenario. What happens in India is patient comes to ICU, patient goes into ventilator. And we don't have any records or will from the patient. Then patient attendants start asking you, sir, take out the patient from the ventilator. So this is what scenario we face most of the time. The law is very clear. Once you start a treatment, you cannot withhold the treatment at any cost. Now, if you want to withhold a treatment,
Vinay, actually, government of Karnataka have issued a circular some months
sir, I will
ago.
complete. I'll
Yeah.
Yes. So if you want to withdraw,
euthanasia.
yes, sir, I will come to it, sir. If you want to withdraw, you should form a primary medical board constituting of the treatment doctor and other specialty doctor. This primary medical board has to come with an opinion that this patient goes into vegetative state and this ventilation can be withdrawn. And this will be cross-checked by one more medical board, which is not from the hospital, which is from the government authority. So both medical boards should come to same conclusion, and patient attenders also should come to the same conclusion. And all three put together should inform district commissioner and take the patient out of the ventilator, which is a very lengthy procedure, sir. So although right to die has upheld by the Supreme Court, because this can be misused left and right by the patient parties because of property issues or something, the government has made very strict guidelines to follow this right to die. Now, if the patient is asking to withdraw life support, what I suggest to doctors is, if they want the patient to take out the ventilator, you should make it DAMA. Because any patient can leave the hospital anytime at their wish. That is very clear because patient autonomy is supreme. The problem comes when we take out the ventilator without following this procedure and allow the patient to die in the hospital. After some time, some other kid of the or other son or daughter comes and files a case against the doctor that he has taken out the ventilator. If you have not followed this forming an expert committee, taking multiple opinions and doing proper documentation, you will be held negligent. So what I tell them, if someone wants to take the patient out of the ventilator, let them go DAMA. Now you take DAMA signature and send them. But if you are taking out ventilator and allowing the patient to die, you make sure you follow all these procedure, or unofficially you should be very confident that patient is very loyal and will not create any problem, which is not legally safe. Adults especially, because my properties and all is involved. Pediatrics it is easy because we are dealing with only parents. But the as sir said, right to die is accepted, very well valid in the court, but a lengthy procedure is there for that.
Anybody want to ask questions, please raise your hand and unmute and ask.
Prasad, there are some more questions in the chat box.
Yes, ma'am.
Sir,
Can you repeat? Someone has told,
read
but
it,
can you
ma'am.
leave it the
Can I
legal
read this
52?
question for you, sir? Can I read this question which you
Yes,
have
ma'am.
missed?
Yes, ma'am. Yes, ma'am.
Dear all, does it come under negligence or contempt of court or cheating the patient, deficiency of services in the consumers forum for violating the human rights, right to life, right to health, when the doctor who knows the Supreme Court judgment ruling that all the lab reports are to be countersigned by the pathologist, NMC guidelines that the pathologist should present physically for authorizing the lab reports, send his patients to a lab where technician signs the reports. So there's a lot of points that this doctor is asking.
I don't know, ma'am, whether that person who is asking is a doctor or someone else. I think that is no need to answer who has to sign what reports and all.
I
If
suppose
someone
you
wants
can
to know,
only
let them
comment on
write
the
to.
you can comment only on the pathology reports, because normally there are too many reports to sign, so they have a seal and they put the seal and
Ma'am,
send.
they can put a digital signature, anything. But whoever name you are issuing the certificate, he will be liable. It is not mandatory that he has to sign with this pen. Digital signature are valid, but he cannot escape liability telling that someone has used my signature. Whatever documents goes out of the hospital or lab are legal documents. Some people write these documents are not valid for legal purpose. It is laughable. There is nothing called not valid for legal purpose. Everything you write is valid, very well valid for legal purpose. So whatever goes out of your lab or hospital can be questioned in the court. The signing authority will be questioned.
But it is allowed. Digital signature is allowed.
Digital signature is everywhere allowed, ma'am. Even ministers are signing in digital signature, provided that he is the person who is responsible for it.
Now another doctor youngster has says, thanks for instilling confidence in budding practitioners. Similar another one also is there. And next question is written. The next question by Dr. Veena. Is written consent mandatory to conduct normal delivery when the pregnant woman has arrived in full dilatation with ruptured membranes, considering atonic PPH as an unpredictable complication?
Ma'am, this is it will be a very lengthy answer, ma'am. Consent is you have written explicit, you have something called implied consent. Patient comes to my OPD, I will not take consent to do abdominal examination because he has come to OPD for examination only. So that is called implied consent. Next is expressed consent, where I am going to ask him, can I do your throat examination? Then that is expressed consent. Next is written consent, where I am going to write that, shall I examine your ears, and he is going to sign. So these are the three types of consent. Law mandates invasive procedures need to be have a written consent. Now oral consent or explicit consent, everything is very well valid. There is no mandatory that it has to be this form of consent. The thing what we need to understand is, now I conduct a normal delivery without consent. Complications occur. Now I am not able to manage the complication. Even if I take consent, if I don't take consent, I will be negligent. Now I take consent and complication occur, I won't be able to manage. Even if I taken consent, I will be held negligent. So instead of consent, we should concentrate on managing the negligence part, or because most of the time only major surgeries this consent. Now patient cannot go and tell that they are not given consent, they have conducted normal delivery. Then the doctor can always ask, why you have come to hospital then? So these things are theoretical, and patient cannot, even judges know all these things. They cannot go on asking, telling court that they are not taken my opinion. When it comes to major surgeries, like hysterectomy, oophorectomy, removal of testes, enucleation, amputation of limbs, or retinopathy of prematurity treatment. These things you have to take a video consent, because these are the patients who are going for litigation later. Video and written consent when you are doing a life changing or a debilitating surgeries. Rest all, if you take a routine consent, that is enough.
So that means to say that when patient comes in full dilatation, you go ahead and conduct the delivery, and as and when the complication touchwood arises, you're going to manage
Yes,
the
ma'am.
according to the protocol.
And you have a people waiting outside. They can sign on the patient behalf when she is in emergency situation. You make sure that you write there. Patient was in a intolerable pain, hence consent was taken from the husband and consent was taken from the in-laws. That is enough.
Yes. The next question, sir.
Yes, ma'am.
Next one. Consent has to be taken in local language or English, sir? Is the next
Local,
question.
ma'am. It is patient understandable language. That is
Any language the
total.
patient can understand.
Yeah. If for illiterate patient, if you take even in Kannada language, it may not be held in the court because patient cannot read even Kannada. So for them, witness is mandatory. When you're taking consent from an illiterate patient, witness is mandatory. Other patient witness is not mandatory. So in Kannada reading patient, you should take in Kannada only. If a patient is reading English, if patient is signing in English, then you can take in English also.
Yes, and then a positive note. Sir, one doctor says, I have been practicing for 3 years now, doing casualty duties. I've never heard of the judgment method, sir. This is a gold mine for doctors like me. Thank you. And the next question is, sir, can you repeat about Live 52 Ayurvedic medicine?
Yes, ma'am. This is like recently in Delhi, one doctor was fined for dengue. It was a dengue patient and died ultimately of dengue shock syndrome. In the prescription, they have noted that doctor has written Leo 52, which is in Ayurvedic medicine. They didn't they didn't punish the doctor. They told you can't write Ayurvedic medication, and some 10,000 fine was given to the doctor. Basically, what I'm trying to tell, even though Ayush doctors prescribe allopathy medication left and right, that doesn't make you, that doesn't give you, empower you to write Ayurvedic medication. So even if they write, something goes wrong, it goes to court. Every time the Ayurvedic doctor has held negligent. Judges have not left them also. Every time when they have written, they have practiced out of the specialty, doctors have held them. Courts have held them negligent. So of course we will be also held negligent if you write a medicine which we are not knowing the knowledge.
The next question, is there any way for out of court settlements in negligence cases?
Ma'am, out of court settlements is like, see, if a doctor comes to know that there is a negligence from our part, like leaving a scissor in the abdomen, amputating a wrong limb, or some obvious, once you read, you will know, okay, this is going against us. You should settle it out of the court only. And there is a way you should get an advocate and take it in the writing that you are not going to, and all the amount should be transferred in white, because you give cash, they will say they have received nothing. So it should be written that so much thing has been paid, and they are not going to go further. And it has to go through legal people only. If you sit and do it in a home, and they can always again file a case against you.
So that means to say, when we know that fully sure that we are negligent, we can go for out of court settlement, but the caution by you is to do it through an advocate and
Yes,
invite.
ma'am. Yes.
So next question. One police patil, I don't know who it is. 1 minute. Sir, explain about doctor beating patient. Recent case to save himself.
This, ma'am, what happens is, see, once you beat doctor, once we beat patient in written, they will file a case. And once they file a case, we will not have any other option other than withdrawing mutual withdrawal. See, if at all a patient is beating you, you save your CCTV footage and you go with your staff nurse, 2-3 witnesses to the police station and make sure they file a case under Karnataka Protection of Medical Establishment Act. That act where the punishment is 7 years and it is non-bailable offense. But what happens is, most of the time they don't put those sections in the police station under pressure or something, and the person will get a station bail. If at all you want to really punish the person who has beaten the doctor, the only way is take CCTV footage, take a local help of a local advocate, take 2-3 people who can say that they have seen that he is beating you, go and do a proper complaint. They can draft a because the punishment depends on what the section they put, whether it's a bailable or not bailable, cognizable or not cognizable, depend on the what the police sections put by the police, and what section they put is depends on the what the complaint you give. So if you draft a proper complaint, of course the law is very strict, especially beating doctors who is on duty, whether it's government or private, it is very strict. But if you beat them back, you will be able to withdraw. You will be forced to withdraw. Or if you are beating, you should be more. You should beat. More than what you got and get it withdrawn finally. Something like that should be done.
There is one more question, sir. In a lot of doctors have got that this thing. In discharge against medical advice, should discharge summary be given
Of
or
course,
not?
it should be given, sir. It is 100% to be given. Actually, if a regular patient goes against, if a patient who is well gets discharged, even if you don't give discharge summary by mistake, nothing will happen because patient has recovered. He is not going to file a case. Who is the people who are going to file a case? Of course, people who are going against DAMA, because DAMA people are unhappy patients. That's why they are leaving our hospital, or they don't like us, or they don't like our billing pattern. Now we know this is a litigant and it can die on the way or die in the referral hospital. These are the cases where we should give discharge summaries writing that all conditions have been explained and they are not followed our treatment, and these were the vitals at the time of discharge. In spite of all these things, they went against the medical advice. Not giving discharge summary itself is a negligence. Now the case goes to court. If a judge asks you why you didn't give the treatment details, we will not have any answer. Then next question he will ask is, oh, you wanted him to die because he left your hospital. Then we will be in a very dangerous situation. So we should give discharge summaries who is going against the medical advice.
If a patient refuses treatment, do we have a refusal consent form?
Yes, ma'am. Refusal, basically there is refusal to consent available. But the problem is whenever if a patient is appendicitis is admitted, he refused for surgery. Two things can happen. Either he can recover with antibiotics or it can rupture and he will go into shock. Now he recovers with antibiotic, he will tell doctor unnecessary, wanted to do surgery. Now it ruptures. Then patient attendants will tell, sir, you would have operated, we were ready to give consent and all. So what I tell, if patient is refusing for your modalities of treatment, you don't admit only. Although if you take 2-3 consent and witness and all, you can substantiate in the court even if the patient dies. But it is very difficult because patient won't be there alive to tell that he refused in the court. So what I suggest is, if you think the patient really requires a emergency intervention and he is refusing, better you refer him to some other hospital instead of unnecessarily getting into trouble.
Then there's another question attached to that. If the patient denied referral and insisting for admission in a peripheral institution and was admitted, and if something bad happens, is the doctor negligent?
The thing is, if he documents everything properly, takes signature from them, then he won't be negligent. But these cases are risky. These cases, once the patient dies, they won't say that they were not ready for referral. They will tell they were ready to go to US. Those kinds of patients are there. They won't be ready to go because they don't want to go. So better if you are giving a suboptimal treatment, better not to keep them.
Sir, one last question in the chat box. After that, Dr.
Yes,
Prasad will take over. Video consent for which surgeries? Kindly explain. Somebody has a doubt on that.
Ma'am, there is no clear-cut guidelines. What I suggest is, if you think the surgery is emasculation surgery or a debilitating surgery or organ removal surgery, along with the regular consent, you take video consent. It is not mandatory. So, because those are the cases which are litigant. So whenever you think you are dealing with a high risk patient or a surgery which can cause severe disfigurement and all, you can take video consent. Like pediatrics, neonatology, ROP, we take video consent. Like because that can cause blindness. And if I'm a gynecologist, if I'm removing a uterus of a 18, 17-year-old child or 20, 21 who has not become pregnant yet, probably I will take. Or amputation, I will take. Or removal of testes, I will take.
So when we
Dr.
have
Depends on individual.
potential litigants, when you feel that the patient is likely to
Or
give
if
us
you're doing a
problem.
major surgery, ma'am, like life-threatening surgery.
Dr.
It is
Vinay,
not
I'm just
mandatory,
adding,
ma'am. Video consent is not mandatory, but it will say it is valid in the court. It safeguards doctor.
Dr. Vinay, when it
Sir.
comes to renal transplant, no, usually
Yes, sir.
video consent is very valid.
Yes, sir. Yes, sir. Exactly. Like transplant, as sir said, is one of the where cost is also very high and outcome is also not guaranteed. So they are valid in taking video consent because patient cannot go back later and tell that I was not aware.
Yes.
So according to NABH, I think they advocate video consent to be taken for each and every surgical case or any even ICU cases. That is, they say it's mandatory.
That NABH is a private hospital accreditation authority, sir. They are not NMC, but they want us to take.
Yes, sir. I think it was really a wonderful session, sir. You're very cool, composed. I think you answered each and every question that has come from all quarters, and really it was a treat to watch, sir. I think before the program ends, I think everyone wants your modules, like whatever you have told. That is the link to be shared on the chat box, if you don't mind, sir. Because I think everybody are very eager to see modules, because whatever you said, there's so many modules and you have prepared each and everything, like all the headings, whatever you are told, it is really worth watching, and I think everybody should download it and keep it, and whenever they have any problem or anything, I think they should consent you, sir. And thank you very much.
Prevention is
for
always better than cure, sir.
Yes, sir. Yes, sir. Thank you, sir. Thank you very much. And I think Dr. Rajeshri is waiting to give word of thanks. Over to Dr. Rajeshri.
Rajeshri, are you there? She is not there.
Okay, sir.
Anyway, I'll be happy to propose a vote of thanks. I think there are no more questions. I recognize the presence of Dr. R.M. Krishnan, past president of IMA Tamil Nadu. And my thanks to Dr. Veerabhadraya, our Karnataka state president. And I thank our guest speaker, Dr. Vinay Kumar. And I thank Dr. Suri Raju, secretary, IMA KSB. And Dr. Harish Delantabettu. And Dr. Anuradha Parmesh. Dr. Indira, and all the people who have attended today's program, Dr. Shankar Narayan. Thank you, sir. With the permission of the president, shall I close the meeting, sir?
Please, sir.
Oh, thank you, sir. Thank you. I will close the.
Thank you, sir. Thanks a lot.
Thank you very much, sir. It was wonderful, Dr. Vinay. Wonderful.
Thank you,
once
sir.
again.
Thank you.
Yeah.
Wonderful,
Thank you,
because this attendance shows the popularity of Dr. Vinay.
No,
So it was a full house at the
audience,
beginning itself.
and a big cheers to all the audience. It was a houseful thing. It was very good, sir. And Dr. Vinay, sir, like this will be remembered forever.
Thank you, sir. Thank you. I'm always there to educate doctors.